It's 7 a.m.
Operating without a net here.
You know, it's calling an audible football season. It's 7 o'clock. We're KUAM FM. I got New Guam. Let's go now to the KUAM News Zoom room where the former chair of the Physicians Advisory Group, Dr. Hoa Nguyen, is standing by. Good morning, Doc.
Good morning, guys. Wonderful morning. It's very cloudy and raining outside.
Yeah, it is. Raining down COVID still. Wrapping up week 8 of this surge, Doc. You were one of the voices early on, back when you were advising the governor, and you continue to say that we were still going up the hill, right? And here we are. Just wanted to get your take on what you're seeing at the clinic, because I know I spoke with you a little bit this week, and it's been very, very crazy for you guys at AMC, right?
Yeah, it's been very busy. You know, we have both the COVID and non-COVID patients coming in. We see the bulk of the non-COVID patient now is because people wait for so long. Complications start, so it's very hectic to try to manage both sides. But you know, so it feels like we are, like I say, plateau and try to recover from this. I think that the number are coming down as the virus are burning out. So hopefully we will see less number and hopefully go back in a double digit the next week or so.
All right, Doc. I mean, so looking at the numbers reported last night, it was 101 positives out of 1,067 tests. So that positivity rate's still up around 10%, which is not sustainable, right?
Yeah, it's actually, it was not, I'm sorry, it was 9.9 the previous day. Today's figures put it at 9.6.
Right, okay.
Yeah. So, you know, it's never sustainable when you get that high because of something will give up. You know, the healthcare system is very fragile.
Yeah.
But I think that we will recover from this for sure. You know, we are going to go down eventually. Just a matter of how many lives you're going to lose and how much risk to the healthcare worker and the frontline taking. You know, like I said, everyone are getting tired. You know, and we have to worry about now the non-COVID surge. You know, so every surge that we have on the COVID related, there's a non-COVID surge afterward that will run about anywhere from 2 to 4 weeks. So we have to get ready for everyone that have comorbidity to start hitting the hospital and the clinic. That's how things are. So we had to get ready, the healthcare worker to take care of the non-COVID related patient now.
Mm-hmm. So you say plateaued. So you mean that we've already gone over, because before you're saying we're still climbing that hill. We've already gone over that hill, and now we're just kind of coasting.
Well, this is a bad place to plateau at, though, Doc.
Yeah, I think that we are picking already, and we are going down. And the virus will have a lifespan, and it will burn out even if we don't do nothing. It just takes longer to recover. But no, I think that from what everything is around the world and the history of the virus, no, we will see a downward trend. It's just the question now is how long that downward trend will last. But at the clinic level, you know, it's just like the pulse of the community. You know, we are seeing a lot of people come in for close contact testing, but the number of COVID positive in the clinic are starting to go down. So that's a good sign. You know, so I think that as a community, you know, our number will start to go down this week or next week, hopefully.
And as they go down, do you foresee the governor, I guess, changing her executive orders and allowing unvaccinated individuals to go into the restaurants and things like that? Or is she going to continue to have this divide between unvaccinated and vaccinated?
I think that that direction not going to change. I think the unvax going to be somewhat a disadvantage as we go forward. But I would say that we should follow the community somewhere around the world that would allow the unvax to attend the restaurant and the gathering. No, there's a lot of testing now. So I mean, you can suggest people to test before they attend those the restaurant, the business. Testing are fast now, so take 10, 15 minutes. So I think that some sort of implementation for testing for the unvaxxed to attend, just like Hawaii, if you are unvaxxed, you can test up to 48 hours before you go to those events. So I think that something like that should be in place because life have to go back to normal for the unvaxxed also, and you have to respect that. Just because some people, doesn't matter what you do, they will stand firm what they believe. So we cannot kind of force them to change their beliefs. So I think we have to respect them and move forward and make some type of accommodations for them to go on their life.
Doc, let me just ask you about the unvaccinated, right? So we continue to have these protocols and measures in place, and the governor's deadline for her vaccine mandate, where she's forcing government employees and private sector employees to get vaccinated. But then she's also saying if you don't want to get vaccinated, you have to provide a negative test weekly, right? So what we're hearing is that the exemptions, right? And so that's another out of this vaccine mandate is you can also file for a religious exemption, a medical exemption. But these exemptions aren't even available. They're still being reviewed at the Attorney General's office. So how unfair is it that we have the governor coming down with these mandates where she's forcing people to take these shots, but at the same time the government is not doing their part to allow people to be exempted from this process?
There's two things, right? The mandate for vaccination and the unvaxxed to be tested weekly. It's really a very hard. I don't know how they're going to even monitor that. It's really everything manual. You have 1,000 people. Like I say that about 1,000 people in Guam or more, and the private business, a lot of unvaxxed on each of the company and business. So I'm not quite sure, how anyone going to monitor that efficiently. It's all the manual process, and you cannot do that. Public health don't have the manpower to do that. So it had to be some type of spot check because, how are you going to ask how much percentage of people in your business is vaccinated or not? So it's an impossible task to do. So that is a challenge by itself on top of everything else that public health have to do. Regarding, exemption from medical and religious belief, it's very hard. I tell you, I know there's some people are going to go in and ask for the physician to give the exam, but the final authority will be a public health, and like I say, I'm not sure who's over there that will be responsible to make a decision for religious or medical exemption or not. You need a very seasoned physician or some type of experienced administrator to make those decisions, because I tell you, it's very easy to challenge in court, and it's very hard decision to make. I feel for them, and we have patients come in and ask for exemption for medical reason, and it's almost impossible to give medical exemption except for pregnancy. That's an easy one to give, just because you have to respect the baby and the outcome of the baby. So that's something you can give, but everything else is almost impossible to give. So I just say that whoever make the decision on public health have a very challenging hat to fill.
Did you catch our interview with Lonnie Navarro from Environmental Health when she was talking about the enforcement they do at the bars? I know that you've seen those couple videos circulating around. She said that when public health responded to those bars, they found no violations, right? And then when we asked her, how do you check the vax unvax? She said they just ask the bar, are you guys checking? And if they say yeah, then they're good. They don't really go in and really verify any of these self-attestations or anything. Do you think that we need to be more stringent in the enforcement? Because you've been Doc, you've been the voice that said it's coming from the bars.
Yeah, I mean, that's reality. That's the data. Everyone, it's not just us. Everyone around the world, but just listen to Sean's clips a little bit there. I mean, the data is there. Every time that you have a safe country, once you open the bar, everything break loose, and it's no brainer for that one. So I think that we just need to realize it and put our foot down on those situations, because once you control that section, it's benefit the whole community as a whole. So I know it's hard to do, but it's like I said, you have to think the whole big picture as Guam, and not just little section of the business. So yeah, I mean, I listened to that and kind of very disappointed because I think that it's just a lot of to me, I'm not mean to say a lot of excuse, a lot of smoke, but you have to deal with the reality. And the video, you can't say that the video is not submissive. I mean, you can't. Those are not actors. Those are real life video. So you have to take those on the behalf of Guam and protect the people and take action to correct it. But it's kind of hard to go and to do an inspection where you go into your uniform and people know you're coming. It's kind of hard to do inspection like that. So they have to come a different way. And also, if they're going to hold business like that, then they should hold the private sector the same. I mean that if you have a wedding or a funeral or whatever, a party at your house or wherever, it had to be the same. You have to maybe hold the host responsible and not go and inspect every individual at the private function. I think it had to be one standard across the board and not to have one standard for one business and a standard for another business.
I kind of wanted to follow up on what you said earlier about this plateauing, because it was just a week ago when you were on here and you were talking about how we needed to have restrictions, that the numbers were going to go up, and if we keep getting these positives, it's sooner or later we're going to see triple-digit hospitalizations. And so I'm just kind of wondering why it seems like you changed your position, because plateau was a word that the governor used on another media.
Yeah, Sabrina, we coming up as expected. I think our highest is 300, but the virus also have a burnout rate too. So we were hoping that it's not hit the triple digit in the hospital. I wish we didn't get, so that's good. I think the best thing that happened to us in trying not to get that triple digit is the monoclonal antibody, treatment. I think the guard did a wonderful job in standing up the treatment center, and that will cut down the hospitalization a lot. I mean, 70% of the patient, the decreased hospitalization, that treatment alone, that will save the hospital. But it's not changed the tune. It's just that we have that standing up. We have the monoclonal antibodies since November of last year. We have not been using it.
Yeah.
But we have that ability to treat on a second surge. But the problem is that the implementation plan are not put in place at that time until now. But we have that since November last year. But again, it's a great way to protect the hospital, and a great way to deal with the surge. Right now, the only thing that we have to do is make sure that the positive rate are coming down. And I would expect, because we've been in there for about 8 weeks already, that the burnout rate for the virus, it will be burnout. So we should see the number of positive rate coming down. We see that in the clinic in the past 3 to 4 days or so. So hopefully that will continue.
Doc, that being said, right, as we wrap up week 8 of this surge, just going back, because this has been, again, 8 weeks, we've seen, did you have that, how many deaths? And, well, we've seen thousands of positive cases.
That wasn't on that thing you sent me.
Yeah, an alarming amount of deaths, right? But we put in these restrictions that you've routinely called ineffective, and they, I mean, just a cursory look at the numbers over the last 8 weeks, it really looks like these restrictions targeting the unvaccinated don't work. But I just want to ask, could we have saved more lives if we had done something early on in this surge?
That's a possibility. After the facts always, give you a better picture. I think that what we have to come out of this surge, if we have to learn from what our mistake and what we need to do, and come up with a solid plan for the next one, right? Because, like I say, this virus is really very dangerous. It will mutate and have another variant. So what we need to do is basically, learn from our mistake here, come up with a solid plan of early testing, strategies testing that effective, and put some restriction together in the fund, and continue the monoclonal antibody treatment to make sure that the hospitalization are low. No, seriously, I mean, as we said before, doesn't matter. We have a lot of positivity in the community. No, we have to try to curve it down to a double digit, a single digit number. But the one that the end line is the hospital. We got to protect the hospital at all costs, because again, it's not just COVID. It's a lot of non-COVID patient fatality that we have to deal with. Just like right now, we will have to plan to deal with the non-COVID surge after this COVID kind of died down. So the next 2 to 4 weeks will be a lot of non-COVID related complication we had to deal with.
Well, I think the people of Guam have done a good job in protecting the hospital. I mean,
Yes.
we have a vaccination rate of 86% as of today. Shortly after liberation, we had an 80% vaccination rate.
Yeah.
Yeah.
So Sabrina, the big difference and the blessing on this surge compared to the last surge is our immunization. I tell you, that will cut down the death a lot. We have like about 41 deaths or something, 42 right now. But I tell you, and the hospitalization, we would not be where we are at this point regarding, I know the number is high in the hospital and the death rate, but we would not be where we are if this surge don't have immunization. I tell you, we'd be in big trouble if we wouldn't have the immunization.
Yeah, Doc, I mean, when you call this a plateau, right? So GMH canceling elective procedures, the capacity of the ICU, even GRMC, when you look at these JIC reports, they are just slammed with COVID. So is this a plateau we want to be on?
No, we will improve. I think that the term plateau can be that, hey, we kind of max out where we are, but this is not where we're supposed to be, and this is not the norm. Like I said, we need to kind of learn from this and make sure that in the future surge that we do things in a much more rapid way that at the beginning, so that way we will not get where we are at this point. And that's the learning lesson we really have to learn and put some solid plan together, and not like we back in March 2020. So so there's a lot of things we can do, but I'm pretty sure that the number going down to the clinic wise we see less positivity coming in to the clinic. And it kind of everything work is magic. It's just kind of good time for the school to open. I think next week. So hopefully, as the trend down, it's also safe for our kids to go back to school also.
So at the end of the day, it sounds like you're saying that it's already too late to implement any new restrictions to try and stop this spread. It has ran its course for the most part through the community.
Sabrina, yeah, right now I think that as you can see that we're not going to put any more restriction there. Doesn't matter what we say. But now that we're going to ask our people to really do the 3W, as you say, and try to courteous itself. And like I said, it doesn't matter what we do. If you go point A to point B, it's the way that we do it. Get there faster or slower. And right now, we are getting to that point. But again, it lasts 8 weeks or more. Mm-hmm. So in the future, hopefully we do things a lot faster. It will last about 2-3 weeks and it's gone. Mm-hmm. So that's a learning lesson from the next surge.
Mm-hmm. Now we just came across that a CDC panel endorses the Pfizer COVID booster shot for high-risk adults, but it rejects plans to distribute widely across America. So that just happened, but we do have a question from one of our online viewers. In your opinion, as a former PAG, about mixed vaccines on the latest news, can one take Pfizer booster if I've taken Moderna?
From the CDC guideline, that's not preferred to mix the Moderna and Pfizer, for the third shot. So it's not something recommended. But if you happen to have it, does it hurt you? No, it's not going to hurt you. Anything else, it will help you to boost your immune system. But it's not preferable. I read one of the story that you guys run about the person that have a mixed dose of Moderna and Pfizer. She's not going to any complication come out of that. She's considered fully vaccinated. So, Sabrina, the end point is that you're not supposed to mix them, but if you happen to mix them, it's not going to hurt you. It's still going to help you.
Yeah, and she's got the super immunity now, though, Doc, right?
Yeah, there's some few study out there that if you cross over, that you will have better response, but that's not endorsed by the FDA.
Oh, darn it.
Stay where you are, and I'm sure Moderna will come out with the third dose pretty soon. They're only behind a little bit.
Hold on a sec, Doc. Here, it's not approved for healthcare workers though. So, what do you think of that? Because a lot of our conversation, Doc, over the last few months has been around the waning efficacy of the vaccine, and you're saying 6 to 9 months after you take it, the efficacy wanes. So, Bree and I were talking about the other day is like I've been holding out for this booster because I'm feeling like if this vaccine that you guys gave me it's wearing off after 6 to 9 months, then hit me with another one. Okay, hit me with another one. But now the booster's out the window. So are we going to have a large segment of our population that's outside of this, immunocompromised elderly group? Are we going to be walking around with a higher risk of exposure because we're not getting the booster?
No, no, it's not. It's not true that it's not. It will be approved for the frontliner. Especially the healthcare worker and the firefighter and the EMT and the police. So it is approved for the frontliner. And they are considered one of the high risk people to do that. And when we talk about frontliner, right? I mean, you talk about the people that work in the supermarket, the people that work in the store, people that provide the essential thing for you every day. So those are considered frontliners. So you're talking about it's a wide variety of people there that will be qualified. Right now it's an immunocompromised patient only, and the high risk is and 65 and over. But this week or next week, when the final meeting is, they will approve for the frontliner to get the third shot, the booster shot. So it's coming at the end of this week or early next week.
Yeah, actually, Doc, I'm looking at some breaking news right here. Advisory committee recommends wide swath of Americans be offered the COVID boosters.
Yes.
Yeah. So it says they had a 15-0 vote that adults 65 and older should be offered booster shots, and a vote of 13-2 that the booster dose should be offered to individuals 50 to 64 with underlying health conditions. And a separate vote, the panel left the door open to 18 to 49-year-olds with underlying medical conditions obtaining a booster shot based on assessment of benefit and risk.
Yes. So it's let up to the physician to make his determination if patient are high risk or not. So there's a lot of comorbidity out there on the patient, and I'm very sure that a pretty moderate portion of our island will meet the requirement. So the question is that, if people have Moderna, can they have the Pfizer? Because the Moderna have not been out yet. So that's a big question. The Pfizer, yeah, a lot of people are beginning to have the Pfizer in December, January, especially that's the elderly folks. They should be coming out to get that shot, and hopefully as early as next week.
Thank you, Doc.
Yeah. But
let me know if you want to give me a little bit of that Pfizer on the side. You meet in a alley somewhere.
If we have left over, I give to you. I'm just kidding. But guys, the school come next week, and I just really like to ask the parents to play a big part in the safety to school for next week opening. If your child have any congestion, any runny nose or coughing, or don't feel well, any headache, please do not send the child to school, and just go get tested to make sure there's not COVID. That's protect the school. Okay, and that's really need the parents to really play a big part in that and make sure that our school is safe. And also the big question that people ask is that if you have a close contact positive in the family, if doesn't matter you fully vaccinated or not, unvaccinated, go check your physician before you send the child to the school. If you have a close contact, meaning that the parent turned positive, you have to ask your physician to see what needs to be done before your other child, the other children go to school. So those two steps right there, the parents play a big part of it, and keep the school open, okay, and safe for our children. So I really ask the parents to play a big part in this one.
Thank you, Doc.
Thank you.
You're welcome.
All right.
Have a good night. Be safe.
You too. Be safe. Wash your hands.
Stay dry.
All right. 7:28. Good morning. Good morning, Bree.
Good morning.
Right on. It's 7:28. We're going to take a break. I also wanted to go through, you did a great story the other day, what to do after you turn positive, right? And so you looked at a lot of the FAQs up on the public health website, because we had that call. It was an earth-shattering phone call